So, hi guys, this
Hi.
is Amanda and Noy.
Hello.
We are doing our project on Empire Outpatient Services, and Amanda's going to tell you their purpose and their mission.
Okay, so I'm just going to read from this part. So, the purpose and the mission, their purpose is to passionately advocate for a drug and alcohol dependent population of this community with evidence-based tool and social models, peer group oriented recovery, introduction to 12-step program, and cooperation with alumni and family groups. And their mission is to provide participants and the communities of Northern Shasta County with recovery opportunities through drug education and process groups and a supportive environment to all who choose to recover from chemical dependency.
So, the services that Empire provides are alcohol and other drug assessment, substance abuse and treatment, and for adult and adolescent. They also have Department of Transportation and aftercare relapse prevention, and vocational referrals are accepted. And then their target populations are adolescent and adults, but till 12-year-old and up.
Okay, for access and payment, walk-ins, appointments, and referrals are methods for receiving treatment. They said pretty much anybody that comes in, they will see, but they would, of course, like to have an appointment, but, emergency situations are understood. They are in the process of becoming listed as a PPO, as they currently are an out-of-network provider. Some costs are covered by Medi-Cal and Medicare, Medicaid, and private insurances, but some costs will be out of pocket, like the detox that they provide in Reading is $150 for a 3-day detox program, which is actually a really good deal. And that is done in-house at the Reading facility. And if an enrollment patient misses an appointment, they will be either dropped from the program or delayed from graduation. However, if the person puts in an effort and communicates openly, then they will be carried out or carried for the certain program circumstances. And they did say that, go ahead.
Okay. So people can refer them like from churches and other healthcare providers and stuff like that. And I think like other professional groups can refer anybody there and they'll help you out. And then we have the confidentiality, I guess.
Okay, so the records are currently still paper records. They do not have computerized systems, and they do keep their personal paperwork put up, and they said it is confidential. But the group meetings that they do hold there are, done with a group setting, so there's always a chance that people could talk in our community about things, although it's stated that they're not supposed to do that. They just kind of let us know that does happen once in a while.
So the extra stuff that they have is they follow the philosophy of social model rehabilitation, which involves peer group that shares their experience along with mentors. The 12-step program that Alcoholic Anonymous group use are an example. They do not hold meetings, just like Amanda said. They do dinners and stuff like that, just to be supportive of the members. And yeah, go ahead.
Sorry, I was going to say they have like picnics and barbecues and stuff sometimes for a sober environment for people. Okay, so overall, our impression and recommendation was a good thing, right?
Yeah, I thought it was a nice place. I've never been there or been exposed to it, but after the meeting, my impression of the place would lead me to recommend anybody who needs a mentor or that needs any support if they haven't gone through it, or if they did. Amanda had experience with it, so I'm glad she told me about this place.
Yeah, I just chose this place in particular. I have family members that you guys know about my sister-in-law that was sick prior, and she had gone there, and they were one of the only places that would take her for detox because alcohol is such a hard thing for people to come off of. They did help her with that. It didn't necessarily work, but like they said, 90% of people don't, they do relapse. So also as nurses, I thought it was kind of important for us. Some people are not exposed to substance abuse. And I thought that we're going to have a lot of patients that are going to have these problems, and it would be nice for our fellow students that haven't had exposure to that to be able to have some reference to go to if their patients are asking them for help.
Yep.
That's it.
I think that's it. Thank
All right.
you.
Thank you guys. Bye.